Our presentation. Thank you everyone for attending today's webinar on older women, gender-based violence and femicide in Ontario. We're pleased today to be joined by Amber Wardell, who is the Communication Resource Coordinator for the Ontario Association for Interval and Transition Houses. I just wanted to mention that this webinar is not only being hosted during the month of November for Women Abuse Prevention Month, it's also in recognition for Victims and Survivors of Crime Week, which is happening, different events and things happening across this week. We also will have another webinar in regards to victims and survivors of crime on Thursday, which we'll talk about later. So before we begin, I'd like to start with our land acknowledgement. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land throughout the ages. We seek a new relationship with the original peoples of this land, one that is based in honor and deep respect. Just a few housekeeping items I wanted to go over if you haven't participated in our webinars before. Everyone will be muted during the webinar today as we do our presentation. The speaker will be visible during the presentation as well as the question and answer period. We are joined with our ASL interpreters today. They will switch screens periodically during the presentation. As I mentioned when you first logged on, you can make the screen larger to see these speakers by either adjusting the line between the presentation and the speakers to make that larger, depending on your screen, or you can change your visible layout at the top where there's a grid and the visual that you would like to see the presentation at. So if you have any questions, you can put that in the chat box, and my colleague Laura Proctor, who's joined me today, can assist you with answering any questions regarding that. If at the end of the presentation you have a question that you would like to provide in ASL, we will promote you as a panelist to ask your question to the ASL interpreter. And then after your presentation or after your question is asked, we will then promote you back as an attendee to see the response from our speaker. We would encourage you to ask questions, put those in the question box. It's much easier for us to make sure your question is answered if you put those in the question box as opposed to the chat box. So please do that. We are recording the presentation today. It will be posted on our website within the next couple of days, along with a copy of the PDF presentation presented today. Also, at the end, we will be asking people to complete a short evaluation, probably take 2 minutes to complete. We do appreciate your feedback and suggestions for future webinars. It helps us plan different topics for events in the future. And lastly, before we get into our presentation, I just wanted to indicate that we do respect people's privacy and confidentiality, and we understand there are circumstances that people may want to address in the presentation. We just ask that you ask questions more in a generality kind of way. If you have specific questions about your own circumstances that we invite you to ask, email us or give us a call after so we can give further assistance to respect your confidentiality. But we do ask you to put questions that might be more generic in the Q&A box that we might be able to respond to. Again, we're always here to support and provide information or referral after our webinars. For those who've joined us just for the first time, Elder Abuse Prevention Ontario is an organization that's nonprofit. Our goal is to make sure all seniors are free from abuse and harm and have a strong voice and feel safe and respected. Our mission is to increase awareness. We do education and outreach to senior groups and service provider organizations to provide training. And we work collaboratively with our like-minded organizations to assist in coordination and advocacy across Ontario, across Canada, with our colleagues to improve the support and services for seniors. So it gives me great pleasure to introduce our speaker today, Amber. As I indicated, she is the Communications and Resource Coordinator for the Ontario Association of Interval and Transition Houses. Amber's worked for over 15 years as a community educator, coordinator, advocate, and counselor for survivors of gender-based violence in rural communities. As coordinator for OAITH, she worked on the Aging Without Violence project and assisted in the development of new tools and resources, focusing on ending violence against older women in Ontario. The OAITH is a coalition of first stage emergency shelter, second stage housing organizations, and community-based women's organizations who work towards ending violence against all women. I've had the pleasure of working with Amber in the past on the Aging Without Violence project, and we're so pleased that she's able to spend time today to share her past work as well as the current work they're doing on the femicide of women in Ontario as well. So I am going to turn it over to Amber, and she's going to share her screen and to provide her presentation. Amber?
Hi, everyone. Okay, just give me one moment. Sorry, I was watching the screen share there. I thought we were sticking with that one. Actually, if you want to just bring that same
Sure.
one up, I've just got my notes
Sure.
set up here. And so I'll just start off with a brief acknowledgement of the land as well. OAITH would like to acknowledge the land on which we work and reside. And the many territories of Turtle Island. These territories, ceded and unceded, are home to many Indigenous peoples who have lived here for tens of thousands of years and continue to live here. As settlers, immigrants, and descendants, and as visitors, we honor and respect the many Indigenous peoples of this land and territory and hope for a more just future together as a treaty people. So just a little bit, we'll go on to the next one, a bit of a roadmap. Thank you to Elder Abuse Prevention Ontario for having me today. Really, my background is in violence against women shelters. I've worked for over 15 years in that sector as a counselor, an advocate, an educator, and I've also worked in other sectors, including family services and working with perpetrators. So I thought some of you have checked in via the chat box, but if you haven't, it would be great to check in. And just if you can note, some of you have noted when you've said hello in the area that you're from, you've noted what your role is or your agency, but I'd love to hear if you are connected with an agency. I know some of your community members and joining us today in that role, but if you're joining from an agency, if you could let us know that agency and your role there. Or if you're not comfortable sharing that, you could also let us know the sector that you work in. So are you working in a homelessness program, for example? And that's great for us to know that information, and you can just keep that coming in as I'm going over this roadmap. So we have a little bit of a summary for you today on the Aging Without Violence project. Is there anyone here you can give a shout out if you're familiar with that project, if you perhaps attended we had a very large conference that launched that project. We'll talk a bit about that. We'll talk about older women and gender-based violence and unique barriers. Femicide and older women in Ontario, we want to really specifically give you some information about that. And today, we won't be able to cover everything. That in particular, we could do a whole webinar just on that piece, but we'll give you all of the links so that you have those and they're in the presentation, so you can see them on the PDF afterwards of how to go and get those reports and get more data and more information on any of those. We're going to talk about responding effectively after we're recognizing warning signs and possible factors, risk factors that are indicating that it could be a high risk of femicide. and also tools and resources. So what we have, specifically what we've developed at OAITH that's available for you, and some tips for taking action. This is actually Women Abuse Prevention Month. So we're very happy to be talking about this today, and I'm thrilled that you are here with all of your questions, and pop those into the question and answer chat box. Okay, so we'll move on to that next slide. So the Aging Without Violence project was a project that was funded under Ministry of Community and Social Services, and it began in January 2018. It was really an opportunity for OAITH to utilize an age lens and focus on those really unique needs and barriers, service delivery gaps specific to older women in Ontario. The project ended, but we still have all of the information related to the project. For example, the tools and resources. We'll look at those a few of those today, as well as others we've developed since the project. And they're on the website. So you can see that we have a specific area that's for older women related resources on the website, and you can find those as well as in our library. And Aging Without Violence, really, it aligned with the Ontario Senior Strategy. And it had a very broad scope where we had a target audience of community members and service providers, and also provided information just around raising awareness and promoting action throughout Ontario. So we'll go on to the next slide. Violence against women as a definition, most of you are familiar with. We wanted to go through just a few of these today and have them listed for you because it's language that we will use throughout the presentation and that you'll see used throughout our tools and resources as well. So we've used the United Nations definition as any act of gender-based violence that results in or is likely to result in physical, sexual, psychological harm, including those threats of such acts. And so that's an important one as well. And when we talk about the violence against women sector, we'll specifically give you some links to this, those of you who aren't in the sector. That's included in the presentation, but just as a really broad overview, it includes emergency women's shelters, sexual assault centers, transitional housing, but also community and school-based programs such as counseling. And those services are available to all ages of women, including trans women, non-cisgendered women. So violence against older women, we really tried to get this acronym active during the project, VAOW. I don't know if it really took. I continue to use it, and I'm an advocate, but it specifically is saying that there's a distinctness there. So that might include physical abuse, sexual abuse, emotional and verbal abuse, financial abuse, spiritual abuse, neglect. It includes really the entire lifespan, and recognizing that those types of violence compound and that they intersect. And that violence might fall under the umbrella, some agencies use that language of family violence, elder abuse, domestic violence, intimate partner violence, intergenerational trauma. When we're talking about older, as I am during the presentation today, I'm really talking about age 55 and older, and we developed that kind of framework at the beginning of the project with some early consultation. And when we talk about who are the perpetrators of violence against older women, that might include family members, caregivers, spouses, partners, ex-partners, neighbors, acquaintances, service providers. And they're more likely than their younger counterparts to be experiencing various types of violence from multiple perpetrators at the same time. That's something where we'll talk a little bit more about that in relation to femicide specifically. So why are we focusing on older women? So really, this is from the Ontario Human Rights Coalition. We know that older women make up a higher proportion of the frail elderly. They're more likely to experience certain kinds of abuse. They're more likely than their younger counterparts to experience abuse by their spouse, and more likely, they're more likely than older men to experience abuse by their spouse. Women over 65 of age, everyone's kind of using different indicators for older. So women over 65 years of age are more frequently the victims of violence at the hands of family members that are men. And really then when we look further down the slide, we can see some distinctiveness between the experiences and impacts of violence for older women versus younger women. So we'll talk more today about the additional barriers to accessing services. We know that there's a financial dependency that's different there in many cases. We know that those intersections of identity, that they are perhaps even further invisible as there's that compounded piece of age and older women and the invisibility of abuse against older women. And really the unique impacts of that compounded trauma throughout the life, and sometimes different attitudes about abuse and relationships, and sometimes distrust of services as well. And I think those are ones that we can build on today. We always learn more every time we have these conversations. So really that intersectionality is integral to all of the work that we do at OAITH, and the next image that we'll look at in a moment does give kind of a visual representation of intersectionality. I think that there's a growing knowledge around that and promising practices. And we definitely have some specific trainings on our training portal that can help to develop that intersectional lens. And specifically some trainings that we've developed in the past few years related to gender-based violence in older women. And really that intersectoral collaboration, so recognizing the intersections of identity in a person's life, but also bringing all of these different sectors together. So violence against women and elder abuse, healthcare, justice, housing. We know there's more than that, but in particular, those are really keystone collaborations, and it needs to occur at all levels. So ministries, policymakers, boards, management, staff, volunteers. We know that promising practices become embedded practices when that knowledge sharing and learning trickles up and down and across organizational structures. So we'll move on to the next image here. And we have a list here of some of the warning signs specific to older women. These are warning signs that you also might see in younger counterparts. However, they're ones that we want to pay specific attention to. And especially because we've seen them in cases with high risk, or in cases that ended in high amounts of injuries, in fatal threats, or in femicide. So changes in behavior, being particularly fearful, physical injuries, physical health problems, including increased chronic pain, financial changes. So who's in control? Are there changes in kind of the ability to pay bills that don't seem to be from another place there? Lack of food in the home, lack of access to medication, as well as assistive devices and essential resources, and lack of information about property ownership or finances. And also caregiver stress, especially in combination with other warning signs. So just to talk a little bit about that piece of assisted devices. Many of you, if you want to just stick on that slide for a sec, many of you have assisted devices, many of you have safety plans that you might use with clients or supports or someone in your community. Have any of you ever used a safety plan? You can just note in the chat that does include information about both risk of violence from, let's say, a partner or ex-partner and assistive devices. So you can note that in the chat. So I'm asking if any of your safety plans that are about domestic violence or intimate partner violence specifically talk about assistive devices. And you can note that in the chat if you'd like to. I'm interested to see. We definitely have seen some of those resources, but they're not the norm. There's typically a separation, and a lot of safety planning and gender-based violence written resources specifically might be targeted towards younger women or people who are able-bodied or cognitively able. So that's something where including information about, for example, in a safety plan, about things to put together in case of leaving a situation or relationship. Does that include extra assistive devices? Providing that assistance in navigating how to get extra assistive devices when we know that they're so expensive anyways. So just some pieces there to think about in how these warning signs kind of play out in our, the actual concrete pieces of the service that we provide. Somebody's noting safety plan, but not over the phone, but intake, yeah. So it might be different what we're doing verbally versus what we've included in our written resources, and including those things in written resources can help to kind of decrease that invisibility of older women and make sure that they that the resources are applicable. Okay, so we'll move on to the next one. So this is a word to the wise. You might have seen these during the Aging Without Violence project. We had these monthly fact sheets, all which focused on a different aspect of gender-based violence against older women. And this is where you can see a visual representation of the actual intersectionality wheel. And you'll see this in some of our resources, and it gives you a greater sense of that, excuse me, intersectional lens and how to apply it within your work. We've also got a few suggestions up top of what barriers older women experience when accessing supports and services. And I just wanted to ask you, I know it's small on there, so you don't even need to read those specific ones, but I'm just wondering from your perspective, what are some of the barriers that you feel might be present for older women in not accessing or not being connected with supports and services, specifically in relation to the violence and abuse they might be experiencing? So I'm wondering, what are the barriers that you guys are seeing? You can pop it into the chat. Laura's put in the link over to find the word to the wise fact sheets. Living rurally, absolutely, and no transportation. I think there's different pieces with rural. We've also got sometimes caring for livestock. There's that access to firearms, the distance of neighbors. We sometimes have different attitudes as well, and lack of access to services that they might not be there. Cultural differences, the language, pieces around, animals, cats and dogs, financial resources. You guys have all sorts of great ideas. To mention cognitive issues, so we have a specifically word to the wise, it's on capacity, that also relates to that. Financial housing and dependence, and that's a systemic issue we know right now with availability to affordable safe housing in Ontario, and not aware of the resources. So you guys have an amazing list. We'll go on to the next one here and see what might be on our list that wasn't on your list. We'll just move on to the next slide here. So this is a list that, as I say, is not necessarily comprehensive. We're always building on this and increasing the understanding, but what are those unique barriers for older women? So part of it is the compounded impacts of violence throughout different relationships over the lifespan. Eve Valdera has done some wonderful work on, brain injury and trying to estimate the number of women that are accessing services or not accessing services that have experienced traumatic brain injury that might never have had that treated, and those impacts, emotional impacts, but also physical impacts of violence and injury throughout different relationships over the lifespan. Risk from multiple perpetrators. So we know that the risk is actually, of course, it's contextualized in her life, but it's specific to that perpetrator. So that risk is about that perpetrator's behavior. So we know that it can be not as simple when we're looking at multiple perpetrators, some which might be a family member, that, for example, a child. So acknowledging abuse from a child has different emotional impacts and different need to overcome that barrier than it does sometimes with other family relationships like a partner. Physical signs of the abuse might be attributed to age-related issues and changes. So of course, if we look at the statistics around falls and injuries, those statistics are based on what was reported to the emergency room or to the paramedics, and that often in those cases, a person might not feel safe or be safe to actually say that the fall was caused by someone who was being violent or abusive or threatening. Fear of loss of autonomy. So there might be threats of specifically that she will be placed into long-term care, especially if that person has power of attorney, which is noted as the next one here. We know that that can have, really great effect on keeping someone, fearful of any kind of engagement with services, even connecting with someone in the community and letting them know what's happening. And we have do have a word to the wise that has the resources specific to, if, for example, there was abusive behavior from a power of attorney, what would be the right resources to contact. So we have that distrust of services, and sometimes that distrust is based on what they feel that, the service might be. And sometimes they've had a history of service use where they've experienced discrimination, where they've experienced bias, where there have been, interpersonal, but also systemic barriers to actually engaging in that service. For example, an older trans woman might have a particular fear of emergency rooms because of past experiences. And those pieces around what are high capacity healthcare services that we might be able to connect with. We can see some of those lists are definitely noted in our resources, as well as Elder Abuse Prevention Ontario. Length of abuse and violence. So something occurring for multiple decades has a different implication for safety planning, for identifying risk, for acknowledging that as abusive behavior, and to seeking safety, engaging services. And those, isolation within isolation, we know that older adults are isolated. We know that those in LGBTQ plus 2SI communities are isolated. And then we have that isolation within isolation of the experiences of violence and the, limited resources. Somebody had mentioned that in relation in the chat to rural areas, but we also know that even in urban areas, there might be limited resources where they're not age specific. So looking at, where are those resources that we can really sometimes collaborate and come together. So senior services might have a lot of information about some senior specific pieces, and the local shelter or the local sexual assault center might have a lot of information about sexual assault and gender-based violence, and bringing those together to be able to collaborate on, for example, creating a resource is always a great way to try to impact and reduce these barriers. We also know that often when there's a degenerative disease and that is, been diagnosed in the perpetrator, it's very difficult to determine what abusive behaviors are coming from power and control and are indicating a risk of or presence of abuse or violence, and separate those from behaviors or symptoms that are actually related to that disease. So dementia would be an example there. And we do talk more about that in our Her Brain Chose for Her resource, and I'll show you more about that later. The lack of knowledge of resources and services, just not knowing that they exist. Any statistics you look at about this are usually surprising to me, that it's quite high. Of who doesn't know about what that's out there. And we'll look at some of those statistics that we've collected throughout the project as well. There might be, as I say, a resource available, but it doesn't have that specific expertise. And, if that person is either a caregiver to an abusive partner, or abusive family member, or dependent on that caregiving from an abuser, we know that that, of course, is a significant barrier. It often takes that collaboration in between sectors to really increase safety. Blame and shame related to raising an abuser, especially in relation to if that abuser is their child. And visibility of violence against older women outside of the scope of elder abuse. So we really, we've worked with Elder Abuse Ontario, Prevention Ontario, within the Aging Without Violence project, and continue to work with them in presentations such as today to really, bring down those silos in between the violence against women sector and the elder abuse sector. Because we know that there are unique pieces of expertise that each of those sectors can contribute to the other. And capacity around technology-based services. There's often an assumption that older women or older adults can't or won't access technology-based services. It really depends on the person. So we know that, especially if there is a brain injury, for example, or different pieces that might impact access to technology-based services or information, that might be unique, but also that some older adults might not have, she might not have access. In a rural area, does she have consistent access that's safe to Wi-Fi? Or to data, how is she actually getting connected, and the safety piece is connected to that as well, right? So safely connecting through technology, and also the reality of shelter spaces, that we know not all shelter spaces are fully accessible in a physical sense, especially to everyone, and part of that is something that is continued to be made aware of and addressed. But there are definitely barriers to that, especially in shelters that are operated out of heritage homes, for example, where it's more difficult to actually change physical spaces. Okay, so we'll move on from this one. And these, next few stats that we'll look at here, they are from the Aging Without Violence project. We worked with Leger Ontario, and we created an Ontario-wide survey to provide some insights into attitudes, knowledge, and barriers to action for the public when it comes to violence against older women and violence against women in general. So when we asked them, what does violence against women mean to you? We really saw overall that respondents noted some type of physical aggression or violence. Well, we still only have about 14% noting any kind of sexual assault, violence, abuse, or harassment as some types of violence. And financial abuse, which is often older women experience within the context of an intimate friend or family caregiver abusive relationship, was only noted by 3% of respondents. So we'll go on to the next one here. And in the next slide, it talks about, just go back one slide. Sorry, yes, thank you. We did some surveys with the elder abuse networks, and you can give us a shout out if you're connected with an elder abuse network. Those are across Ontario. You can see the locations on the Elder Abuse Prevention Ontario website. And we talked with them. We did some focus groups, but we also did these surveys and really wanted to hear more about promising practices and also barriers in relation to that intersectoral collaboration. So we did see that only 9% of the networks were saying that their violence against women coordinating committee was connected with their elder abuse network. So we really are encouraging that connection. If you're connected with the violence against coordinating committee, you can also give us a shout out. And it would be great if you're not aware, if your community has an elder abuse network, to look that up, or vice versa, to be looking up if you are aware of the elder abuse network, if your community has a sometimes called VAWCC, Violence Against Women Coordinating Committee. However, when we asked them kind of what they were focused on, 69% of them said that they sometimes focus on violence against women specifically during meetings. And we've got that report on the OAITH website. At the bottom there, you can see that they gave us more information about how they focus on a gender lens in their work specifically. So you can read more about that. We'll go on to the next slide here. And this is just about, what are the reasons? We've talked about that, some of the barriers. You guys have identified these to actually reporting. Reporting, I think that language, is that to a support? Is that to the justice system? That's a whole other presentation. But in general, people in Ontario were telling us fear, shame, stigma, they're not aware of the help available, and that financial fear, and the impacts of divorce in later life, and that financial dependency. So going on to the next slide, we have a list of some of the warning signs that Ontarians are identifying with that might mean an older woman is experiencing violence. So again, it's that focus on the physical. Well, we only have about 10% recognizing that an older woman's level of fear might be something to be noted. So we'll go on to the next slide here. When we asked Ontarians what they know about, and this really aligns with data that we've collected through different presentations. When we do, presentations or workshops where we're collecting information from different sectors, we find that there's not a lot of information about the other sectors sometimes, when we're, especially if we're talking to non-service providers about what's out there, who can help in relation to violence against older women. They definitely identify the police, but then not so much when it comes to other services. So we only had 19% identifying women's shelters as an avenue for help, and elder abuse organizations and hotlines only 5%. So we'll go on to the next slide here, and this is a list of high risk factors separated by what the background is, what the context is of that list. So the first one is from the Domestic Violence Death Review Committee out of Ontario, and those are the top 10 there. We have a history of domestic violence, actual or pending separation, the perpetrator's depressed, obsessive behavior displayed by a perpetrator, prior threats or attempts to commit suicide, victim had an intuitive sense of fear, perpetrator sexual jealousy, prior threats to kill victim, excessive alcohol and drug use, and perpetrator unemployment. And then we have the Be Safer, which was developed by Randy Kropp out of BC, serious physical sexual offenses, serious violent threats, ideations or intent, escalation of physical, sexual violence or threats, ideation, intent, violations of court orders or civil or criminal court orders, negative attitudes about spousal assault, other serious criminality, relationship problems, employment and or financial problems, some substance abuse, and mental health issues, especially those which are untreated. And then looking at the Jackie Campbell Danger Assessment on the far right, which was developed in the States by a nurse, Dr. Jackie Campbell, the increase in severity or frequency over the past year, and you can use a calendar. Dr. Campbell provides resources once you've done the training as well to do that tracking. Might own a gun, has left after living together during the past year, unemployed, has threatened to kill her, has avoided arrest, specifically for intimate partner violence, domestic violence in the past, that there's a child that is not his, forced sex, strangulation, choking. Jackie Campbell has noted, and we'll talk a little bit more about this in a later slide. I've had conversations with her about this, and the reason why they note choking on the danger assessment, even though you choke from food, it's not from an external like strangulation, is because often survivors don't identify the word strangulation with what they experienced unless it was fatal. So that language is specific there. Illegal drugs, alcoholic, problem drinker, he controls her daily activities, violent, constant jealousy, if she was assaulted by him when she was pregnant, also suicide attempts, so threats and threats to harm the children, and fearful for her life. And so that's just really, a very brief snapshot. There are also tools and resources that are very specific to elder abuse. And some of those focus specifically on, a caregiver role. So these are ones that are talking about gender-based violence and doing that assessment, or considering those, potential risk indicators of a domestic homicide, a femicide, a fatal, escalation in a situation or relationship. So we'll move on to the next one here. This is an image from our last Ontario Femicide Report. So many of you are familiar with our femicide work at OAITH. We do publish in November every year. So at the end of this month, we will have our annual report that we have available, all those annual reports on our website. And we also have been doing work just over really this past year related to monthly tracking of femicides. And so femicides, I've noted the definition we're using for you here. Everyone or many people doing this work define femicide differently, but femicide for us describes the intentional killing of women, children, and other gender diverse individuals by men. And since 1990, OAITH has tracked over 900 femicides across Ontario. As I say, this image here of we've tried to show an escalation in the steps there visually. That is from our most recent femicide report. And in that most recent monthly femicide report, we noted the increases across 3 different femicide types, including intimate partner violence. So intimate partner femicides was 42.86%. Family femicide was 133.33% increase, and femicides involving a known perpetrator was 80%. So looking at that known category, this known relationship can include femicides that were perpetrated by a neighbor or an acquaintance. That category also includes other femicide types where the relationship between the victim and the perpetrator has been reported, but there's no details regarding the nature of that relationship. So as a result, some of those cases might potentially involve a victim's intimate partner or family member. And our femicide reporting is done through media reporting, and that's why you'll see in our reports that we note, these are the limitations to some of that data. And very specifically this year, we have worked with the media on developing some media recommendations. So you can find that on the femicide section of our website as well. So we'll move on to the next image here. And this is an image from our previous report. So the last one you saw was from the October report. And then this is from the September 2021 report. So we're trying to highlight something different that's of note in each femicide report. And what we pulled out of the September report was really around that continuing rise of femicides of older women. So older women ages 55 and older continue to be at the greatest risk for femicide and are continuing to experience violence from multiple sources. So when we look at that a little bit further, we'll go into the next slide. On our last annual femicide list, we had over 40% of those women were over 55 or older. And then if we actually include those, because 55 and older is, that's just the marker that we've used. But if we include 50, so women who are 50 or older, that's nearly half of the women who are on our annual femicide list last year. That's 48.6%. And when we look at, those older women, they're really the only age group of anyone else on our list with that similar risk from an intimate partner or a family member or someone of unknown or unspecified relationship. So that's a unique piece to consider as we're working towards really addressing and preventing femicide in Ontario. And you can see there a little image on, or that we showed an image there on the right of those reports. They are available on the website. So this is a word to the wise fact sheet that we published during the Aging Without Violence project that was also saying, so we're still talking about this. It's still, but it's something that we've been talking about for several years. So yes, we identified, back several years ago that femicide rates of older women are increasing in Ontario. And we can see that 45% of the femicide victims from, this was looking at December 2017 to November 2018. So it's almost half again, were 55 or older. So when we compare that with the 2016 to 2017 data, that's nearly doubled. So you can see on the word to the wise, we also talk a little bit about who are the perpetrators of violence against older women. And then you can see that there's some comparisons there on the top related to femicides by age and comparing that over different data periods. And in each of our monthly reports, we include information that's about an age comparison and also the types of perpetrators. So we'll go on to the next slide. So 46.7% of the femicide victims age 55 and older from last year's annual report, looking at some of the intersections of identity were identified as white. 26.7% of the femicide victims ages 55 and older were identified as being visible minority, South Asian, Southeast Asian, East Asian, and Black. And it is important to note that there are several limitations to the OAITH femicide data, but specifically the race-related femicide data because of that reliance on media sources that I mentioned. So media reports do not often identify a victim's race. While it's important that race is not overly emphasized in media reporting to prevent victim blaming and ensure that the case is understood as a gender-based issue, that limitation can create challenges for researchers. So additionally, not all femicide cases receive media attention. In particular, we know that cases involving Indigenous women and girls often receive little to no media attention. And as a result, the data that we collect might be incomplete. And in order to identify the victim's race, photographs of the victim found in media reports can be used for those coding demographics, but we recognize those limitations. And there's a large number of cases in which the victim's race is coded as unknown. And we include that lens and that information in each of our monthly reports as well. So we'll go on to the next slide here. So Peter Jaffe has some recent workshops that have been coming out through his work with the Learning Network. And we also did some work with Peter Jaffe with the Aging Without Violence project, and he presented related on older women and domestic homicide. And that full presentation is available on oaith.ca. And it's nice, you can view his slides on one side and automatically watch the presentation and the video of Peter presenting on the right side. And Peter talks about those specific risk factors. And also that we can see that when we have, different age, there's a different number of risk factors. And all of those are really key considerations when we have an agency that is hopefully working together with other agencies to determine what is the risk level, but also just as important as determining the risk is determining what is a plan to mitigate that risk. And that's where we see that collaboration is really key. And when it comes to older women, that might mean collaborating with brain injury services, for example, and perpetrator services that are healthcare based, that or healthcare services that might be providing services to someone with, for example, dementia, who is also a perpetrator in the situation. So we'll move on to that next slide. And just some of the characteristics of older women femicides and domestic homicides as identified by the Domestic Violence Death Review Committee would be intact marriages, depression within the perpetrator, dementia within the victim, and the spouse as a caregiver. However, I'll note here that we do have, a really wide range of types of relationships, and not just partners when we're talking about these femicides, specifically for older women. So we'll move on to the next slide here. This is actually a page out of Her Brain Chose For Her. You can download Her Brain Chose For Her from the herbrainchoseforher.ca, and you can access it on our website, or you can access it as an application where you can actually complete the tool, you can color things in and learn additional information. So this is from page 32, and it shows how just 20 pounds of pressure is needed to open a soda can, and 11 pounds of pressure on the carotid arteries cause unconsciousness. So 4.4 pounds of pressure on the jugular vein, for example, with a belt, might cause unconsciousness, which could last seconds, minutes, hours, days, or result in death. So we know that, the number of traumatic brain injuries reported by women are going up. We know that there's likely a lot that are never identified, that are never recognized as a brain injury, especially with that, issue in identifying it as strangulation often, that someone might not feel that resources about strangulation are focused on them, as it wasn't fatal, and might not be aware of the impacts of non-fatal strangulation. Traumatic brain injury really disrupts many parts of the neuroendocrine system and growth hormones and estrogen, and it's a risk factor for cognitive decline and accelerated aging. And we also know that there's more research needed in that relationship between traumatic brain injury and older women, specifically around the impacts of menopause. And the symptoms of menopause are also similar to post-concussion. So we can see sometimes there is a invisibility of the symptoms because of age-related, age-related kind of things that she already has going on in her life and in her body. So we'll move on to the next slide. Adults over 55 who've experienced a traumatic brain injury have a 44% increased risk of developing Parkinson's over 5 to 7 years. And many times, especially when it comes to strangulation, people don't associate that with traumatic brain injury. But when there's that loss of oxygen to the brain, that's where we see, of course, that, the full range. There's many different levels of traumatic brain injury. That risk doubles following a more severe or more frequent traumatic brain injury compared with mild or, a single type incident. And 66% of traumatic brain injuries for older adults are due to falls. So that's where, again, it's hard to know how many of those falls are perhaps in the context of an abusive situation. And there's been definitely a lot of focus in the literature over the past 10 years in relation to the need for healthcare to have really very thorough training in assessing and confidentially assessing if there is an abusive situation or a risk of abuse in an emergency healthcare situation. So we know that an MRI actually cannot detect a concussion a post-concussion or a mild traumatic brain injury, and that symptoms from a traumatic brain injury might not show up for hours of days. And really, the older age a person is, more negatively influences the outcomes for traumatic brain injury. And that one size fits all approach to managing older adults can often neglect the issues related to gender and age and all those intersections of identity that we spoke about. And preventing head trauma can prevent neurodegenerative diseases such as Parkinson's. So just some pieces there. Really traumatic brain injury in older women is also a large topic, and we can talk a lot more about that. But if you wanted to learn more about that, a great resource is our training portal, where we have a course related to understanding gender-based violence and the neurobiology of gender-based violence across the lifespan. So we'll go on to the next slide. And this is a question that we commonly have from community members, and that many of you might have received as a service provider or support about what should I do if I'm worried about an older woman, but I'm not sure if she's experiencing violence or abuse. So one of the first things that you might do is really identifying through some of the warning signs that we've looked at, what is it specifically that I'm worried about, right? So when we share our worries, they're often most impactful if they are specific and if they're also often time relevant. So we're saying, I noticed this the other day, perhaps, and this is what I'm worried about. So if we go on to the next slide, we'll just leave it up and look at it for a second. Are you experiencing domestic violence? So pop into the chat. Does this question work with older women? Or if you haven't used it, would you anticipate that this question would work with older women? Let me know. And I'll be quiet for a second so that you can think about that and respond. So, that language of are you experiencing domestic violence? There's a few different pieces to consider in there. Somebody's noted, the word bullying might be specifically more relevant, especially depending on the type of relationship. Domestic violence, of course, is only going to cover certain types of relationships, right? If it is a partner, it's not necessarily going to still be the best language to use. So some people, will identify that they use this language, that it might have been helpful for them. What we found typically, if we ask this type of question, is people saying no. It's not necessarily the best question for younger women. It kind of assumes that somebody has an awareness of all of the different behaviors that would be considered, to fall under that domestic violence or whatever language you're using. But it's also not one that we see older women necessarily identifying with. And that might be because domestic violence for them means something very specific. It might mean a certain type of physical abuse, for example. And it might not include, threats or psychological or emotional abuse. So I think that language of domestic violence, and kind of asking it in that specific way is something that sometimes we see in screening tools, or we see that's in a policy, but we know when we're actually using that, we have to think a little bit more about how to actually connect. So we'll move on to the next slide that just goes over, what are some questions that might work better? And if you have a thought on this, pop it in the chat so people can see just some responses to, that question of, are you experiencing domestic violence? Some are saying no, it might hurt your connection and trust with her. Some are saying, do you feel safe at home? Move on to a direct question. That's a great suggestion, Deborah. Most don't want to admit. I'm apt to ask more questions, like, do you feel safe in your relationship? So do you feel safe in your relationship? We're maybe not sure if it's about that specific person or that relationship. Are you feeling safe? Is there something happening in the community at home that you're not feeling safe about? Some other suggestions here on the slide. Are you ever fearful of your partner, ex-partner, husband, family member, child, whoever that is that we might have a little red flag about? If you had a magic wand, this is kind of for more so an ongoing or more in-depth, perhaps a counseling session, but what would you change about the behavior of your partner, ex-partner, husband, family member, child? What do things look like when they're at their worst? Do you ever feel like you're walking on eggshells around your partner, ex-partner, husband, family member? And this is my favorite. I could do absolutely a whole presentation on sleep and gender-based violence. And I think if we were to ask this question more often, and yes, it has relevance for all ages, but specifically for older women, when we look at the impacts of age on sleep quality, on sleep retention, when we look at what might be keeping her up at night in relation to the abuse and violence she's experiencing, whether that's sexual abuse, whether that's nightmares, whether that's fearfulness, those pieces around how have you been sleeping, I think can lead us to really, really great, very fulsome answers from a question that is quite innocuous. And we also, we talk a little bit about that in our training around vicarious trauma and asking that question to service providers. And also a great question for, someone in a caregiving role. So moving on to the next one here, just some tips around effectively responding to concerns that an older woman is experiencing abuse or violence. So that private location is really key. Consider that piece if you're virtually connecting around, is there going to be tracking? How will we make sure, how can we help to make sure that there's privacy in that information that's shared virtually, and expressing your concerns really clearly based on the warning signs that you've noticed, and starting from a place of safety, focusing on not maybe addressing everything and not maybe bringing up everything, but really opening up the door to future conversations, and asking questions and reflecting on the language that she's using. So somebody said bullying. So you might start off with that language and kind of reflect that until there's more kind of knowledge built around some of the other terms that might be applicable. Taking more time to build rapport. And really, that is a scheduling difficulty. Absolutely get it. Some service providers have spoken about the value of assessing the way cases are assigned or caseloads are evaluated in their agency, and that a complex case might count as multiple other cases. So if you have a max caseload of 20, you might only have 15 if you have several of those that are complex cases. And a complex case might include multiple perpetrators, generations of trauma, decades of trauma, that compounded, traumatic events that have been unresolved throughout a person's life, and that an older adult, an older woman takes more time often just to complete, that conversation and to provide that service and support. But if you don't schedule it, that sense of rushness is very evident to the older woman that you're working with. And there is often a sense from older women that they don't deserve the service. They might not think that what they're experiencing is abuse or violence, but the more that they're rushed, the more that really compounds that sense of them not being worthy to get direct support. Recognizing that taking action is a process and not an event. Acknowledging unique barriers, providing transportation, a safe phone, accompaniment to a resource, not just a referral. Information overload is definitely a consideration for all survivors, but when we look at older survivors, giving them 5 pamphlets with 10 different crisis lines on it is not an effective way to communicate information, especially when they are dealing with something that is really impactful in their lives, like a recent assault or a recent separation, engaging with services for the first time. So how is it that we can really kind of take the empowerment model and apply it differently? So older women have told us and have told those that we've worked with, that's great that you're providing the phone and all of the numbers. I don't want to learn how to call this number and advocate. I want you to call the number if you can and advocate. So it's different than what we hear from younger women and what we sometimes know in our work in this sector, in the violence against women sector, is kind of skill building and promoting that self-advocacy that older women are telling us, if I didn't identify that I wanted to build that skill, are there things you can just do for me? And so we have to consider that in kind of how we do things. Avoiding assumptions, and if possible, identifying high risk factors and assisted safety planning. So this is just like an example sentence. Jean, I'm worried about you. You seem to be having a lot of physical injuries lately. And I also noticed you seem anxious. Can we talk more, about that? Or about, you might specifically note something. Okay, and we'll go on to the next one here. So these are some strategies for calming. And it's again some quick tips. So trying, I wonder if, let's try, it seems like, and avoiding, it will be okay, calm down, you can't, why did you do that? So some of these are about kind of mindfulness, and especially those working with older women have told us about the really wonderful impact of that body awareness and the self-grounding. Elder abuse and senior services do quite a bit of work with music therapy and art therapy, and a lot of those skills can be taken up and supported cross-sectorally. For example, having a sensory object like stress balls and clay, those are great with people who might not be fully, might have different cognitive impacts, who might have verbal impacts, also who have arthritis and joint issues. And they also have that, activation of all the creative parts of your brain. So we'll move on to the next slide here. Some more quick tips. You'll see these in the PDF so you can review them more. Scheduling that extra time. Large print resources, so that would be size 16 typically. And looking at your font, are you using an accessible font? Typically, making sure that you've got linguistic and cultural appropriate resources, that collaboration, again, in between systems, system tables specifically. So the elder abuse networks are listed on Elder Abuse Ontario's website. And then we've also got, we can provide that connection with the Violence Against Women coordinating committees. But if you search that, or if you contact your local shelter, they can typically point you in that right direction. Training, curriculum, and tools specific to risk management with older women. So not just assessment, but risk management, which includes really the perpetrator monitoring and supervision. So that becomes quite nuanced when he has specific health issues and she might be a caregiver, especially. Cross-sector collaboration, and that includes older women in the workplace as well, whether they're volunteering, whether they're working, and not excluding that, piece around her safety planning because of her age. Collection of data is not always occurring. We need to have that data so that we can have funding, so that we can develop those tools and resources and really reduce those barriers. And avoiding lengthy to-do lists, going to older women whenever you can, actually offering services where they are. So for example, if your service sets up a little information booth in a apartment building where they have a lot of older adults, that might be something where it's a different outreach than waiting for them to contact you. So we're going to skip past the next slide and go to the one after that. So we'll skip past this one. Yeah, so this tree tracker worksheet is available on the OAITH website. And it's a really great tool that you can use as a service provider or community member, but then you can also use it with older women to see kind of, you know, in her whole life. So like your life as a tree is the metaphor here, right? Whatever is happening at the roots are impacting the leaves or impacting what we can see. And this is something that you might do, you know, over time and then save it. So you can also track how you're doing and kind of see pieces that might have been in that, you know, self-care plan that need to be reintroduced, or really identifying some of those roots of trauma that need to be further explored. Thank you to Laura, has put the website in. So we've got just a little bit, sheltersafe.ca. You can find the shelters in Ontario, OAITH.ca. Then go to older women. There's like a little spot right at the top that says older women. That's where you'll find all this stuff we're talking about today. We'll go on to the next one here. Just a few more resources for you to have related to violence against women resources in Ontario. If you go to sexual assault support, you can find a sexual assault center in Ontario. And if you go to SADV treatment centers.ca, you can find your local sexual assault domestic violence treatment center, which offers much more beyond sexual evidence collection kits. So they offer support and a wide range of services. We'll move on to the next one. There are recordings as well on the Ontario Elder Abuse website, as well as OAITH's website. Those are some of them there. We have one about older women in long-term care, and we have one about colonization, oppression, and racism, and violence against Indigenous women who are older. So you can view those and check those out. The next one is just an image of some of our fact sheets we've talked about. So those are all on there under Word to the Wise is what those are called. And then the next slide is just showing you that her brain chose for her, which I referred to a few times throughout the presentation. There's over 30 black and white illustrations focused on helping service providers across sectors really understand and visualize the neurobiology of trauma across the lifespan. So you can check that out. It's its own application, but also PDF. They've got some exercises in that training, such as flip your lid exercise, which is really great for, you know, we've seen that used with service providers as well as survivors of all ages to really help them understand kind of the impacts of complex trauma, especially. And then there's some posters available. We'll go to the next slide, and you can download the PDF of these on your website. This one has a spot on the right where you would put, you know, you could add in your logo, you could add in, you know, your local crisis line or something like that. And then if we switch to the next slide, this is one where it's got the senior safety line, and this is for kind of the general public. So the other one is more so for, you know, within your agency or for service providers, and then this one kind of anywhere. So the next slide is showing you the Aging Without Violence section of the website. So you go to OAITH.ca, and then there's older women on the top right, and it'll bring you to this where you see the banner. And we've got all of our research and data and reports, and you can kind of choose whether you want to see them and have things filtered as, you know, a support for an older woman, or perhaps you're a service provider, or perhaps you are someone experiencing violence who's seeking support, and it will kind of give you the right resources for that. So the next slide is that Word to the Wise that I mentioned a few times about capacity in older women. And that's one that people found specifically helpful just in giving an overview and some thoughts about older women, gender-based violence, and capacity assessment. So you can find that there on the Word to the Wise list. And then I wanted to just mention as part of Women Abuse Prevention Month, we are actively really creating new awareness and hopefully new actions across Ontario under our Wrapped in Courage campaign. So I am wearing a Wrapped in Courage scarf, and I pop in the chat if you're wearing a purple scarf today. And we've got our list on the Wrapped in Courage website. It goes to December 10th. That will really be, promoting all across Ontario and having flag raisings and proclamations. But we've got that list of 16 actions to end violence against women and prevent femicide that's on our website. It's at wrappedincourage.ca/16 actions. So it's a different website than the OAITH one, but we run it as well. And it's over 60 shelters that are participating this year. And those 16 actions can really be taken by anyone. So it's recognizing that, when it comes to gender-based violence, when it comes to femicide, and specifically those increasing rates that we're seeing against older women, it is the role of everyone. And we all have, specific actions and a responsibility that we can take to impact these things. So we'll look at the next image quickly. It's just showing the base purple scarf. So you'll see this on social media this month. And, Women Abuse Prevention Month, is highlighting the need for more awareness of what we're talking about today. And Wrapped in Courage, we use that purple scarf to symbolize that the courage of a woman alone is not enough. It really takes the support of an entire community to respond and prevent gender-based violence. So this next slide is just a few quick numbers. And we've got Elder Abuse Prevention Ontario, the Senior Safety Line, the Assaulted Women's Helpline. They can refer you if you're not sure about the right service related to gender-based violence. And we also have the number there and the website to the Sexual Assault Domestic Violence Treatment Centers. And you can gather all of those from the PDF once you get them. So we'll move on to any questions. We'll move on to the next slide, actually, so you guys have that there, but we will do questions now. And I'll take a look. You guys have been very active in the chat, which is wonderful. And we have one that's come in via the Q&A box. How does one deal with perpetrators who are in systems and related agencies where they're working, peers support each other and ignore the abuse? Okay, so Carla, I feel like if you can see my my information up there, amber@oaith.ca. So I'm wondering if this might be a better one to connect with specifically and just follow up with. So you could email myself, or you could email the folks over at Elder Abuse Prevention Ontario, and we could talk more about this just to have more of a sense of the context of that question. And then I'm just going to look over and see if there's other. Yes, we are going to send a copy of the slides. Some folks are asking that. We'll send that PDF copy. And I'm just looking if there's any others that I missed. Let me know, Rhiannon and the other folks.
Laura, I'm not sure, Laura, if you've seen any other questions that popped up in the chat during the session. I was going to ask Laura.
No, there's no further questions in the Q&A box for now. But we do encourage everyone to get your questions in. So Amber, you got her here right now. Get them in and she can answer them live.
Yes, I just like to thank you, Amber, for your great presentation. And it's alarming the increase of femicide of older women, 55 and older, and that we need to, pay much more attention to that. Start, becoming better educated, looking at these warning signs that you've identified and how to have these conversations with individuals, because as we know, most often it's, individuals that are friends or neighbors that are in close contact with those people that suspect something's going on, but not really comfortable or knowing how to answer or start the conversation. So you provided some really good tips, I think, for everyone, and suggestions how to overcome some of that hesitation to start the conversation. And it doesn't have to happen right away. It can just be started, and then that person knows at least you're there to support them. So thank you for your presentation. I thought it was really well done, and provided as much as we do these together and the work that we do, you still learn something every time that we do these presentations. And with your ongoing research with femicides, I think it's important for, everyone to be aware of the work that you're doing across Ontario and with other community organizations to prevent and stop this from happening to all women, not just older women.
Rayanne, we do have a couple questions here that I would love to have the opportunity to pose to Amber. The first one is, at what point do you involve police and or the medical authorities?
Yeah, so thank you for that one. I think it's a really important question. And one of the things I always like to say, I don't know what sector this person's from, but one of the starting points is to say, if this person was not older, how would I be feeling about this differently, right? So when we talk about capacity, and especially in most cases where somebody's asking this, there hasn't been, it's not something where somebody is not having the capacity to make any choices for themselves. And even that capacity is different, it's layered, right? What type are we talking about? Are we talking about the capacity in relation to having court processes or day-to-day pieces? So for me, in my work in the violence against women sector, it would very much be about at what point the survivor, the person experiencing violence and abuse, wants the police or medical authorities contacted. The limits to that for most agencies in the violence against women sector, which they would pose, would be if a child is at risk, and if there is, there's that piece about an imminent crime, right? So somebody was saying, I'm threatening, I'm making this this threat that's imminent. So that piece around for survivor or victim services is very different than if you're asking that question as part of perpetrator services, right? It's also very different than if you're a community member who is seeing something in the community, right? So if you're seeing an assault in the community and you're not able to, that person can't say whether or not they want authorities contacted, it's an emergency situation. You're contacting perhaps the police, but we know that autonomy and choice is really, really key. And if you refer to the police and a person is not on board, the police won't often have the evidence to be able to do what they need to do, or to take action to create pathways to safety. And it might really disconnect that person from services and systems, right, where there's that distrust piece. So it's really dependent on that situation and if there's an imminent threat or what's happening. But if at all possible, if you can safely ask the survivor, what they would like. And a really great suggestion there for that person would be contacting their local violence against women service, which most of them have an anonymous, confidential, 24-hour crisis line or support line, and they can maybe share a little bit more to get some more context there, because that choice of when to involve, it's also mentioned medical authorities. So that's a different piece in relation to whatever your concerns are. Are those related to a medical care piece or someone who's in a medical caregiving role not providing adequate care? Or are we talking about something else, right? So lots there to that one, but touching base with a local resource would be great too.
Thank you, Amber. The next question is more of a statement, I think, but I think it's really important to highlight out of this statement, what I'm getting is that there's such a high need for all of us service providers to work together and get out of our silos. And this really highlights it well. So it looks like the client wasn't ready for a capacity test, however, was experiencing memory issues. Safety was definitely compromised when the service provider asked about safety. And the service provider then had to get the doctor on board and looks like trustee or POA for finance. Any comments around that statement, Amber?
Yeah, I think we've got some other pieces coming in through the chat around, that piece around the information that needs to be kept confidential, and safety compromise. When working with different sectors, they often have different policies and different mandates in relation to what they can or can't or will in certain situations are mandated to share. And that becomes, the differences there become very, very clear when we look at elder abuse and specifically older adults and sometimes medical services and also justice sector services in relation to, for example, shelters or violence against women services or sexual assault centers. And that piece around once we're collaborating and providing information, there has been, there is sometimes that risk of the confidentiality being not respected because their mandate can't respect it, basically, right? So not an interpersonal worker, but more systemically, that there's so many differences in what the rights are for that person, especially when it gets into capacity. So thank you for sharing that to the person who shared.
Thank you, Amber.
And I think they've moved over to the other side. So I think they're mostly resolved those questions. There was one that we encouraged the person to follow up with us personally, so we could hear more about it. And some of you have put some great things in the chat, but I'm not seeing other questions.
You're on.
We just have a couple more minutes left. So I just want to thank everyone for participating today and for your great questions and interacting throughout the presentation, because it does make it more informed dialogue with our speaker and engage with other participants, just hearing from everyone. So I appreciate you sharing your opinions and voices today. And thank you to Laura for helping moderate the sessions today. I do want to just tell everybody about some upcoming webinars that we have. And I think they'll be interesting to many of you because we've touched on a few key issues that we will be addressing in the next couple of webinars. So on Thursday, we do have a webinar on the restorative practices to elder abuse. This will be a little bit different than the ones we've done on a restorative justice, looking at more of a community response, working with our community partners to assist older adults. And that presentation is from speakers from Waterloo region. So if you go on our website and find that out. But we're also, as I mentioned, we are doing events throughout the week, including this webinar around victims and survivors of crime. We're going to begin that presentation with our annual Volunteer Recognition Award ceremony for elder abuse networks who've been working tirelessly across Ontario to promote education, awareness, and prevention of elder abuse. So that'll be about the first 15-20 minutes of our presentation, and then we'll go into the webinar on restorative practices. And then next week, we have a huge lineup. We start with a webinar with our physicians with Dr. Mark Yaffe, him and his colleague will be talking about approaches to elder abuse, looking at a family physician's perspective. So many of you may have heard of Dr. Mark Yaffe. He had done the EASY tool, the Elder Abuse Suspicion Index tool to identify abuse. So when people were today talking about medical responses and how we, what's their role in responding, or if you call a report, they will be able to give you more of their perspective from a family physician's response in terms of not only identifying, but also responding, because they are not, unlike police, they aren't mandated to report that to the police either. So they'll go over the roles and responsibilities from a physician's perspective. Then the next day we have a keynote speaker talking about vicarious trauma, because we know that everyone that's working in the field sometimes can feel a little compassion fatigue and tiredness. We have to look after ourselves, and sometimes we don't realize this is building up, and looking at our recovery and resilience in the work that we do. So Maureen Pollard's going to be talking about small steps that we can take care of ourselves and look at what does vicarious trauma mean and impact it can have, and how we can support ourselves and each other in our workplaces, supporting victims and survivors of crime. because we all do great work, and looking after ourselves allows us to look after others that we're in support services for. And then we, Amber did mention Peter Jaffe today. We also have a presentation following up on the work that Amber spoke about today, but looking at preventing domestic violence of older couples, lesson learned from tragedies. And he's done some recent research that he's going to be talking about. And our colleague, Margaret McPherson, who Elder Abuse Prevention Ontario has worked with and continues to work with. And the looking at developing a roadmap around elder abuse prevention, or a strategy around elder abuse prevention across Canada. So she's been very engaged and works with Peter in this area. So that'll be a very educational, informative presentation to build on what Amber has talked about today in terms of risk management and safety planning and risk assessment. Just going into that a little bit further from that presentation. So we also have a number of other ones coming up. So please look at our website. And as Amber said, her contact information is here. We'll give you the links to the PowerPoint and the video recording of today on our website in the next couple of days when we get it uploaded to the website. And again, thank you for attending. After, you'll get a quick pop-up just to answer, I think there's 7 to 8 questions. Probably take you a minute to finish, and we would appreciate your feedback for coming today. And there's our contact information at our organization and my contact email and our head office. So thank you again. Thank you, Amber, for taking the time. I know you're very busy to share all the wealth and knowledge that you have, and all the best in your 16 days of action and your Wrapped in Courage campaign. And we will be promoting that as well on our social media to increase awareness across our sectors of this important work that you're doing. So thank you, everybody, and we will see you at our next webinar.